How does angiography pinpoint bleeding ulcers? Imagine trying to find a tiny leak in a complex network of pipes. That's similar to how doctors locate bleeding ulcers inside the stomach or duodenum. Angiography is a powerful imaging technique that helps pinpoint exactly where bleeding is happening. It works by visualizing the blood vessels that supply the gastrointestinal tract. The process begins with inserting a thin tube called a catheter into an artery, usually through the groin area. The catheter is carefully guided to the arteries leading to the stomach and duodenum. Once in place, a special contrast dye is injected into the blood vessels. This dye makes the blood flow visible on X-ray images. As the dye moves through the vessels, the doctor watches for any signs of leakage. If there is an active bleed, the contrast dye will escape from a ruptured vessel into the stomach or intestinal lumen. This appears as a bright, focal area of contrast outside the vessel, often called extravasation. This leakage confirms the presence of an active bleeding ulcer and shows its exact location. Angiography can detect very small amounts of bleeding, as low as half a milliliter per minute, making it highly sensitive. Besides confirming the bleeding site, angiography also maps out the blood vessel anatomy around the ulcer. This detailed map guides interventional radiologists to perform targeted treatments, such as embolization. During embolization, tiny coils or particles are delivered through the catheter to block the bleeding vessel, stopping the hemorrhage. This approach is especially useful when endoscopy cannot control the bleeding or is not possible. In cases of bleeding ulcers, angiography is often used after endoscopy if the bleeding continues or the source isn't clear. It is a vital part of advanced treatment strategies, helping to quickly locate and control bleeding. However, angiography requires active bleeding at the time of the procedure to visualize contrast leakage. If bleeding is intermittent, it might be harder to detect. It also carries some risks, such as vessel injury or reduced blood flow to healthy tissue. Overall, angiography provides a clear, real-time picture of the blood vessels involved in bleeding ulcers, enabling precise localization and effective treatment to prevent serious complications. Always remember, if you or someone you know is experiencing gastrointestinal bleeding, seeking prompt medical attention from healthcare professionals is essential for safe and effective care.